It's my life. It's my life.
HDA.
It's my life.
Infotainment.
It's my life. It's my life. I'm gonna keep it healthy every day. It's my life. Oh, 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 oh. It's my life. I'm gonna keep it healthy every day. It's my life. Oh, 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 oh. It doesn't matter if my pockets are thin. All that matter is the riches within. So many people die of paper chase, but I am living my life with a happy face. I am living my life like a king in his kingdom. I am ruling my world and nothing's gonna hold me down.
When is the driver coming? It should be any moment. You must have gone to pick the children from school. You said, when will you learn to drive? My husband will not wait. Why? He said he doesn't want me to stress myself.
So you mean all you do is to eat, sleep, and play?
What do I do, my dear?
You know, it's so amazing how you eat so much and you don't seem to be putting on weight. I mean, look at the kind of things you eat. It doesn't look like you're watching your weight, and yet you're like this.
That's how I see it too. I wonder myself.
Or are you doing some kind of exercise?
Exercise? You want to kill me? Ah. I want to use my phone.
Are you okay now?
Yes. Thank you.
This you're going to urinate all the time is really giving me concern.
And what's wrong with that?
I don't want to sound pessimistic. Do you remember Auntie Bola?
Auntie Bola.
That's my auntie that died last year.
Yes, Auntie Bola. Yes, and what about her?
This was how she started. She started drinking too much water, passing excessive urine, eating too much food, and so on. And before we knew it was diabetes, it was too late, and that was how she died.
So what are you insinuating?
I think you need to see the doctor.
You know the thing about these doctors. You go to them with one thing and they just end up blowing up everything into your face.
That's not
Even
true.
you miserable. Please.
That's not true. So, okay, you want to remain like this without knowing what is wrong with you?
Nothing is wrong with me. And they say what you don't know don't kill you.
Ah, Chica. Who is feeding you with all these snare beliefs?
Nobody.
I think you're hiding something.
What?
I don't know. With the way you sounded, I mean,
Alright.
I don't want you to end up like Auntie Bola.
Please, I'm eating.
It's my life. It's my life.
HealthTv.
It's my life.
Infotainment.
It's my life. It's my life.
Ada?
I'm gonna keep it healthy every day.
Ada? Where did your mother say she was going to?
She said she won't go see Auntie Beauty.
Since morning.
No, not be since morning. No, you never to tell where she come out. Now just 5 hours. You never.
Ada, shut your mouth. Shut your mouth.
Yes, sir.
Now get out. Get out.
Worry you. I don't tell you, see, I know they like that kind of play.
No vex. You get anything with person if you chop like?
Nothing.
Huh? And that baby. And that fine baby.
You two like food.
If I don't like food, what I call like?
I don't call no who like food pass between you and Madam.
Why you talk that kind of thing? Now, Madam, now. That man, they chop like cow. I don't know where they chop the food enter. Fat, you know FIFA.
Clement, I go tell Madam for you.
I beg, no common food from my mouth.
So you sabi fear?
Why no fear?
I beg you go.
I never get another work.
Just go, I beg. Clement, you don't do.
It's my life. I'm gonna keep it healthy every day. It's my life. Oh, 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 oh. It's my life. I'm gonna keep it healthy every day. It's my life.
Waiter, a bottle of malt, please.
Ma, you said?
Give me a bottle of malt, please.
A bottle of milk.
Chica, your stomach will burst though.
I can't help it, my dear. I should eat when I'm hungry, shouldn't I?
But this is not normal.
Thank you.
Sorry, ma. What is...
You can go with the tray.
Okay.
Go with this. Chica. Just eat, let's go.
I don't know what in this world they turn to.
Wetin happen?
That woman, now everything she dey chop. She would dey chop rice. She dey drink malt. She dey even dey eat chicken on top of everything.
Only her?
Only her.
Now what? This is na her and her friend get am.
Her husband dey try. Sincerely to God, that man dey try.
Everything na she chop.
Everything na she dey chop.
Hey.
Babe, make I go to my work, abeg.
Abi, I will see
That one
you
no
later.
concern me.
Bye bye.
I want to go and later.
Again. It be like say as they eat am, na so you dey piss am.
Beauty, leave me.
Please call your driver, please.
He's coming.
Ada? Where's Haruna?
Now you carry Madam come out.
What about Clement?
Ingo didn't inside the room.
Go tell him to get the jeep ready. I want to go out.
Okay, sir.
Hurry up.
Oga, you won't go find madam. Sorry.
Hello, doctor. Yeah, good day. Okay. My worry is that she keeps growing lean, despite the amount of food she consumes.
Okay, from what you said so far, I think the right has diabetes. But we can't be sure from now until we conduct the test on her.
Okay, but then I doubt if she can come to the hospital.
Then you have to be serious, because any indication of being diabetic can prevent one of the damage to the body.
Yeah, that I know. I'll do what I can. Thank you so much.
All right.
Have a nice day. All right.
It's my life. I'm gonna keep it healthy every day. It's my life. It's my life. I'm gonna keep it healthy every day. It's my life.
Diabetes mellitus is a chronic metabolic condition in which we have excessive blood sugar levels resulting from a relative deficiency of insulin. Either the insulin does not exist at all or it's in small quantities, not enough to drive the metabolic functions of the tissues. Insulin is a hormone that is required to drive glucose from the blood stream into the tissues that require this glucose as a fuel, as a nutrient, to carry out their functions. So where the insulin is either deficient or even where it's available in normal amounts, it does not effectively do that function of driving the glucose into the blood, into the tissues. Diabetes mellitus could develop. Diabetes mellitus, like I said, is a metabolic condition caused mainly from the fact that there is damage to particular cells that we have in a special organ in the abdomen called the pancreas. So the pancreas produces insulin. This insulin helps to drive blood glucose. So when we eat, our food is converted to glucose. It makes glucose in the blood very high or abundant. The function of the insulin is to drive this glucose from the blood into the different tissues that require the glucose to be used. When the pancreas is damaged, either from what we call an immunological condition where there's attack or destruction of the pancreatic cells from normal cells of the body, this we say is an immunological process, or damage from the presence of infection, which could be bacteria or viral. We get destruction of these cells in the pancreas, and there's no production of insulin. And this is what we find to cause the type 1 diabetes. The type 2, however, we actually could find normal insulin levels in these people initially, but this insulin is ineffective in driving glucose from the blood into the tissues. And we find this, so in the type 2 people who tend to be obese, overweight, sedentary people who have significant family history of diabetes, and they develop the type 2. This is actually a myth. A lot of people think, oh, you eat sugar and you get diabetes. It does not cause diabetes. Or when you are predisposed, when you already have a risk of developing diabetes and you eat simple sugars, or sugars especially in the simple form, meaning you eat ice cream, you take cakes, these quickly get absorbed into the bloodstream as glucose, and they cause very high levels of glucose in such individuals. And so if you already have a predisposition or you're at risk and you eat this high sugar containing food, you then could develop diabetes. If you also have been diagnosed with diabetes and you eat this high sugar containing foods, it makes your control of diabetes poor. So eating sugars, if you have no risk, is not a cause for diabetes. But if you have a risk factor and you eat these common sugars, you definitely will be making your diabetes develop earlier than later. So if we've diagnosed you with diabetes mellitus, we have several modalities for treating. We have the non-pharmacological, or what we call lifestyle treatment or modality. In people who are overweight, we ask you to bring your weight to an optimal weight for your height. So we always talk about what we call a body mass index. We require you to have an appropriate or a normal body mass index, so an appropriate weight for your existing height. We require you to exercise routinely, 30 to 45 minutes of quick-paced walking on a daily basis. Is also a modality that we recommend to every diabetic. We require you to stop smoking if you're a smoker, because we know that smoking in the presence of diabetes increases your risk for heart diseases and increased death in such people. If you drink excessively, we ask you to moderate your alcohol intake, or to at least make it sensible, because of the increased risk on your heart as well from excessive drinking. So these are the non-pharmacological things that we recommend. Of course, in addition to that, the diet, which is a big area of our diabetes treatment. Diabetes treatment is multifaceted, meaning different groups of people. You have the doctor, you have the nutritionist, you have the therapist. So the nutritionist will be teaching people about the appropriate type of food to eat, things that you must avoid, and things that you are allowed in certain quantities. So whether or not you're on treatment, we still require that everyone goes through this lifestyle modalities or therapy. So if you're on treatment, either it be the insulin or the tablet form, we still ask that you watch your diet so that it's not high in carbohydrate, so that you don't get those very high levels of sugar that, by the way, damage your pancreas further. So if you're already on treatment and you decide you just want to eat excessively because you're on treatment, if you get very high sugars, it causes a vicious cycle, because your pancreas, which might still be producing a small amount of insulin, could actually now be damaged further. Diabetes mellitus is a condition that is not curable, and I want people to remember that. Not curable, but it's controllable, highly controllable. So because people end up in some herbalist homes and somebody gives them a concoction and they say they have cured their diabetes, go and eat all the yam, go and eat all the bread, because we have cured you. The pancreas does not regenerate once it is damaged, unless you go and get a pancreatic transplant, meaning we give you a new transplant that starts producing the insulin, then we say you're cured. So let us understand it. We cannot cure it, but it's a condition that is highly controllable. How do we control? With the lifestyle modalities I mentioned before: exercise, keeping an appropriate weight, eating right, avoiding the simple sugars, and taking your medications if you have been found to be such that the lifestyle modalities alone do not control your diabetes. So there's no cure, but it's highly controllable. If you keep to the routine that the doctor talks to you about, keep up with your follow-up, the clinic. So when we say come back every month, is make sure you come back, because we need to keep checking your blood sugar, make sure your levels are fine, and the dose of your medications could be altered or changed depending on what the blood sugar level is. So we already talked about one way, and that is that you lose weight. You lose a rapid weight. People are they get really hungry, and then yet they're eating a lot. So you're hungry, you have a voracious appetite, you're always eating, but you're losing weight. You also find that you're passing a lot of urine. So somebody might be a judge in court, and he always has to stop his court sessions after 40, 30 minutes because he needs to go and pass urine. So once you start having that frequent urination,